Good morning, everyone. Thank you for joining our webcast on mental health effects and coping with the COVID-19 pandemic. My name is TV Sai Gonzalez, and I am one of the program coordinators for the South Florida Southeast AIDS Education and Training Center. Before I introduce today's speaker, I would like to cover a few housekeeping items. Please note that today's webcast is being recorded. The recording will be available for viewing before the end of next week. We have designated some time at the end of the training for questions and answers, but we encourage participation throughout the webinar. In fact, Sonia has added a couple of polling questions throughout her presentation, so please participate. We also encourage you to type any questions or comments in the chat box or the Q&A box located at the bottom of your screens. You can also use the raise hand icon to have your mic unmuted. So without any further ado, I would like to introduce today's speaker. Ms. Sonia Brown Boyne is a licensed mental health counselor with over 30 years of cumulative experience in the fields of education, substance abuse prevention, and mental health treatment. She has worked in both private practice and the community-based nonprofit arena with a focus in the areas of substance abuse and childhood sexual abuse. In addition to her role as ATC faculty, Sonia is currently the social worker for the University of Miami's Comprehensive AIDS Program and adjunct professor for the Counseling Psychology Department at Trinity International University and the National Motivational Speaker. Sonia, thank you for joining us this morning.
Good morning. It is more than my pleasure to be with you this morning. I hope that everyone is well. We know that this is a repeat from Tuesday's presentation, so thank you for coming and logging on. Hope that we do a decent job for you today. And this is the first in a series that we're going to be doing over the next couple of weeks as we all kind of hunker down and navigate through this COVID-19 pandemic. So as Tivasai said, there are going to be some questions that are involved in today's presentation so we can be as interactive as possible. And I always say at the beginning of my presentations, I do not have all the answers. There's so many things for us to discuss that they all won't get answered here, but hopefully we'll be able to drill down even more deeply over the next few weeks and just kind of continue holding hands as we walk our way through this concept. When we think about the objectives today, my goal is to kind of make sure we have a good understanding of what we're faced with, what we're experiencing from the technical side. We can do the next slide to the side. What we're addressing in COVID-19. So what the technical aspects of it are and how those are influencing our day-to-day life. So we want to think about the factors that are impacting us and then what those become, what they look like in our day-to-day lives. And then at the end, we have a section where we'll talk about what are some of the things that we'll do to address those. Again, the list is exhaustive out there, not on the slides. So please, as we go through, as I said, throw in your ideas, your thoughts, and we'll continue to explore them over the next couple of weeks. So objective one, what are the stress-inducing factors related to COVID-19 and this pandemic? Well, we'll start off, next two slides, I'll start off by giving you the statement that we're working from. Next one is that COVID-19 is more than a physical problem. We know that we're dealing with a disease. We're dealing with an illness. We're dealing with the impact of it globally from a physical place, but we have to understand going through this that there's more to more to this issue than just a physical problem. So that's really what we're going to take a good look at today. We start off by understanding that, of course, if you've been doing your reading, you know that COVID-19, the CO stands for corona, the VI stands for virus, the D for disease. It was originally called SARS-CoV-2. It's referred to as a novel coronavirus, novel meaning new, and not novel as in a book that you just read last week, that they're all different types of coronaviruses. And this one is one that's never been seen before. We know the symptoms are flu-like, shortness of breath, the cough. We've got the incubation period that leaves so many people susceptible because we're not necessarily seeing symptoms at that time. And so initially this idea was there was this new flu. If you were anything like me, hands up, you kind of said, what is the big deal? It's the flu. I got my flu shot. We're going to be okay. Well, it wasn't until March 11th that the World Health Organization deemed this a pandemic, and pandemic coming from the root all people. So this is a pandemic because it's worldwide. It's affecting a high proportion of the population. And in the past century, FYI, there have only been 4 pandemics caused by the emergence of a new influenza virus. So in my generation, this is the first one that we've experienced. And for people who have lived over 100 years, they might recall the 1918, I think it was the swine flu epidemic, but we haven't had this type of experience before, to the degree that when we look at the statistics, I try and update them. So last night, as of last night, according to the World Health Organization, we've got 896,450 cases globally and 45,526 deaths. That's up 200,000 since I did this on Tuesday as far as global cases, and up another 12,000 as far as deaths. And then here in the US, those numbers continue to rise as well. And so what happens when there's something new, the way the brain works is to put things together and make sense of it. The gestalt, the idea that there is wholeness, that if I drew dotted lines in the shape of a 0, you would probably fill in the blanks to make it a 0. It's the way the brain works to make things make sense. When we can't make sense of things, because it's how we survive, we survive by prior knowledge. I've seen this before, or I've seen something like it. I've navigated through it. I know what to do with this. When we get something that we've never seen before, that we've never experienced before, and we can't, it's almost like trying to dive into an ocean when you've only ever swam in a pool, and you're trying to find the bottom so that you can get your bearings and come back up. When that doesn't happen, we experience fright, acute extreme anxiety even, and we call that the next P word of the morning, panic. So when we have this pandemic, as we've been experiencing it, and we don't know what to do with it, from the bottom all the way to the highest person that has never seen it before, and we're all trying to figure this out across the world, then there is the potential for panic. And where there is potential for panic, and when panic starts to show up, then we also have the risk of pandemonium. Pandemonium, by definition, being a wild uproar, a chaotic situation. So we have the potential out of this pandemic for not just the physical illness that comes with it, not all of the results of the physical aspect, but the mental and the emotional components that come along with it. So this morning, the goal is to try to bring us to a place of putting things in perspective. I'm all peace today. So we're going to try and put things in some sort of perspective so that we can continue to press on and press through. If you're on this morning, it means that you're already determined to navigate this thing well. So let's take a look at think about what the factors are now that we have a base of where we're going from. And we'll take a look at the next slide. When we consider the next slide, We understand that when we're faced with any kind of situation that's kind of shaking up the world, shaking up our own personal world, a personal illness can impact us in any way. Imagine this globally as we're experiencing it, where there's going to be stress. By definition, it's the physical, chemical, emotional factors that cause bodily or mental tension, maybe a factor in disease causation. And today we're looking at it as a result of and the correlation to disease as we're experiencing it. So 3 different types, just for definition. Eustress, that's the good stress, that's the positive stress that gets us motivated, gets us going, moves us forward. And hopefully by the end of today, we'll have a little more eustress than we do the acute and the chronic stress. So acute stress, short term, presses in. It can become toxic if it lasts too long, if it's coming from a place without a kind of breathing room, kind of holding your head underwater for a long period of time. The chronic stress that comes after is a longer term stress, and it impacts every area of a person's being. So when we think about the nature of the pandemic and the fact that right now we've already been in it, almost in waves and rings, when you're thinking about how we've watched it progress across the globe and coming in toward us, and now here in the US as we're experiencing it, we're already at the chronic stress place. And if you're anything like me, like the analogy that I thought of when I thought of this was, if you live down here in sunny South Florida that has hurricane season for how many months out the year, we go through this experience of, we know it's hurricane season. We get the report that there's something out there crashing around in the waves. And the people who are really good at figuring out what's going on out there then give us the information, and we're bombarded with it through the media outlets. There's a storm out there. There's a potential storm coming. It could be a Cat 5. I don't know why they haven't developed a Cat 6 yet, because they all seem to be getting Cat 5s now anyway. So we get this report, and from the time we get the report that it's out there, we start responding to it. So that acute stress starts coming in, but we start responding to it, and depending on how long it takes for it to build, and depending on our previous experience. Remember when I talked about prior knowledge, depending on whether or not I lived through Hurricane Irma, Hurricane Katrina, or Hurricane Andrew, I'm going to respond to the news and the forecasts very differently than someone who has never been hit and thinks that the best time to go surfing is the night before the storm. So we put it in that context of what we've been experiencing comes from that place of, I don't know how bad this is going to be. And so we experience stress. Well, in this particular case, next slide for me, Tivasai. In this particular case, let's think about where that stress could be coming from. Have to consider that there are different domains. You always have to consider the different domains, because we are whole people. So we've got physical that we talked about. When in this capacity, as we think about the pandemic and coping with it, we have to consider, how is this impacting me physically? Well, some of it, the restraints of being at home. For some of us, the fact that we have other chronic illnesses or comorbidities that have to be addressed, that have to be taken care of. We have to consider those things. When the mental, I'm going to clarify mental and emotional. This came up on Tuesday. So when we think about mental and emotional, we're thinking of the thinking place versus the feeling place. So a lot of us, the stress that comes mentally comes from all the things we have to think about and take care of. The financial stressors, the managing our home, working from home, taking care of those amazing, beautiful children who you wanted so desperately and now cannot leave your home and will not leave the refrigerator and are asking you to help with schoolwork that you have not seen in 20 years kind of stress. And then there's the emotional part, the relational pieces, how this is impacting us emotionally, the social distancing, the not being able to connect with others. And then the fourth, and I'm going to go into each of these a little bit more deeply in just a moment. And then the fourth that I've added here is the spiritual component. And I put this here because although in the arena for many of us in the arena of mental health in particular, we stay away from exploring the things of this of in the spiritual domain for various reasons. And yet, if we ignore those, we ignore an incredibly important part to us as individually. Of us as individuals, we're made up of all of these different domains. And if ever there's a time to kind of navigate how the spiritual or the existential piece plays in, now is the time as we're facing mass illness, mass suffering, and death and dying. So we're going to talk about how those weave through. So the next slide is going to ask you which domain you have been most experiencing stress. So as you pop in your answers, you're going to type in which of these domains, or select which of these domains you think you have been experiencing the most stress. Go back to that for me to the side. Let's think about it again mentally. Think about things like the financial stressors. If you've had to take time off from work and you didn't plan to, if you do not have benefits that will protect you while you're away from work, when you have to think about how your bills will be paid during this time, when you have to think about if you have to go into your savings that you've been saving for a house, or you've been saving for a vacation even, or anything, and you've got to go into those things. The challenges of securing everything that you need during this time. Can you get the groceries that you need? The uncertainty about how long this thing might last. Consider if that's impacting you more deeply than the other things. Will you be able to face the costs that come along with this kind of experience? And then when you think about, again, separating the mental from the emotional, again, considering the social distancing. I love them. Seeing you guys throw your answers in there. Keep it up, keep it up. When you consider the social distancing or the isolation, one of the things to keep in mind is that alone does not equate to lonely. But for many people, especially I think of down here where we are collectivist societies that are used to getting together for Sunday dinner, or used to getting together for Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday dinner, that are used to game nights once a month, that are used to picking up the kids from Nana's house and being able to hug on each other, though the emotional component of that. Also considering being in a space as we're sheltering at home and staying at home now, being in the same space with people who you loved deeply until about 36 hours ago when they got on your last nerve. So think about the stress that comes along with that emotionally. Also, and boredom, think about boredom. When you thought that you go to work every day for 8 hours and it felt like you didn't have enough hours to do your work, but now because you're working from home, you get it done in 3 hours, and then you're twiddling your thumb and going to the refrigerator 20 times a day with the children at home. Physically, again, and this kind of ties to the mental, the potential for exposure, not having access to your providers for care that you need, whether physically or for mental conditions. And then spiritually, the uncertainty or the ambivalence that are coming from this life change, having to face death and suffering. And I say death and suffering separately because for many of us, there's a place where death doesn't seem, we've reconciled that we all die and we're all going to get there. For most of us, suffering is a bigger issue. If you've ever watched The Princess Bride, spoiler alert, there's this line in there where there's this duel and the one challenges the other and says, "To the death." And the other responds, "No, to the pain." Because for many, there's so much pain that enduring pain is so much harder than the idea of enduring death nobly. So again, remember, each of these, we're going to spend the next couple weeks in drilling down even more deeply into each of these and how we're experiencing and how we're responding to them. So let's see, what do we have to decide? Where are numbers looking like, in which categories? Are we seeing more folks thinking mental? I definitely saw a lot of mental going in there, a lot of spiritual responses there. The emotional doesn't seem to be, oh, nope, somebody just said emotional. What are you seeing, Tibisai?
Yeah, I see answers in all four categories. We have definitely a lot of mental, but I have seen physical, emotional, spiritual. So we have a little bit of everything in
Yeah,
all categories. We have,
beautiful. Thank you all for giving your answers there. I think mental is probably rising to the surface because of the understanding. There's a cognitive piece to this that is so much harder. Usually when we're coping with the situation and we have some place to resolve the understanding of it, then we can work out of it with the other situations. Because we're not able to understand this, it is so much harder to understand everything else that's going on. So first of all, I want to tell you all, you're very, very normal. Thank you. And there is absolutely zero wrong with experiencing the level of stress that you may be experiencing in each of these domains. So let's press on a little bit more. As someone just said, the impacting, just looking at some of these comments, being impacted by having to take care of others, the responsibility of taking care of our clients and our patients while we're also having to take care of ourselves. So amazingly, um, thank you. The idea of knowing how to respond quickly, so mentally you're able to manage things quickly, but then you face these situations. Someone just said, I haven't slept in like 3 weeks, and it's beginning to hit even harder, feeling helpless. So let's drill down a little bit more, and talk about the effects of each of these. So when you have this kind of situation going on, we'll move to the next section here. Thank you all so much. The transparency that's just pouring out and your willingness to share what's going on is a big deal. This is part of how we resolve and how we cope and how we address this situation, is being able to see that we're not alone in it. I love this Bride quote. I love the Princess Bride. Thank you. So let's take a look at how the effects of stress. So we just talked about some of the factors that are coming in and producing effects. And you may not even know how it's showing up, because for many of us, the emotional shows up in the physical. If you're an emotional eater and you don't even know why you're eating at the time you're eating, and it's absolutely connected to, you're just looking at the physical part of the eating, not understanding where it's coming from. So let's take a look at these 4 domains and understand how stress in general shows up and how it shows up in relation to this particular pandemic that we're experiencing. So when we talk about the physical part, you pay attention to one of the major things is to consider is that social isolation affects health and mortality, especially if it's connected by loneliness. But even without it, there is an aspect of this COVID-19 that is frightening because of the isolation that comes at the end of life, and because of what we're experiencing even as we're living through it. So we need to understand how your body is responding to the stressors. Do you experience headaches? Are you having back and shoulder stiffness? Is there pain in your body that you weren't having before? Stomach upset, heart palpitation, sleep problem. That person who said, I haven't slept in about 3 weeks. You understand that all of those are the ways that our body is saying, I'm not okay. And we have to give room for that. If you do nothing for yourself during this season, give yourself room to understand what your body is saying and to respond to it and take care of it. It's kind of like when you think about a baby crying, when you have a little baby and that baby is crying, and unless you have like parents that, or grandparents, because I'm a grandparent, so I take credit, you can hear that baby cry and know that's a wet cry. No, that's a hunger cry. No, that's a hold me cry. And you have to start paying attention to how your body is crying out. Is it saying, I'm hungry for what's in the fridge? Or is it saying, I'm hungry to be held by someone who I trust and love and is safe? Is it saying, I am hungry for a greater sense of safety? Is it saying I'm hungry for rest? So start paying attention. And when we talk about how to resolve some of these things today and more over the next couple of weeks, we'll get more strategies. I'll be giving you a lot more strategies on how to identify what's going on and how to address those things. So I hope it'll be helpful a little today and more over the next couple of weeks. So pay attention to what your body is saying. When you think emotionally, manage your level of irritability. Identify where there are feelings of anxiety, and this connects also with physically. Where do you experience anxiety? Before this came along, if you were watching a scary movie, where did the tension show up when you heard doo doo, doo doo, doo doo? Was it in the pit of your stomach? Was it in your shoulders? Did you clench your hands, and then when it was over, you realized that your hands hurt because they were tense the whole time and you didn't even know it? So pay attention to where it's showing up in your body. Are you restless with emotional, as you're processing this emotionally? Someone said heart fluttering. Pay attention to that. Hostility. This shows up in hostility where you're irritated and you're aggravated, and you think it's at the folks on the screen. I see your dialogue about the powers that be and what they're saying and how they change their minds every day. There's a lot of irritation with them, but more often we're irritated by the fact that this is out of control, as in nobody really has ever done this before, so they've never navigated through it before. And so the hostility that comes up, the jaw clenching, pay attention to that. It's important. If you're a clencher, you might be a nighttime clencher. So you may clench your teeth at night without realizing it. And then when you get up, or the next couple of days, you feel like you have an earache. And it can feel like you have an ear infection because you don't realize that you're clenching. So pay attention to things like that physically. And the symptoms of depression, not wanting to get out of bed, feelings of hopelessness, the changing in your appetite, either someone said they broke their teeth earlier this week, clenching. Stop it. Get a plastic mouth guard, okay? Changing in appetite, sleeping too much or too little. Pay attention to those. Behaviorally, big deal on this one, because this is where we start acting out. We engage in overeating or undereating. We engage in, that glass of wine that you used to have with dinner at night becomes a glass of wine that you have with breakfast and lunch and dinner and dessert. Pay attention. Increasing in smoking, increasing in high-risk behaviors. High-risk sexual behaviors often comes out of this. Also, again, remember what I said earlier, physically, that desire for connecting. It's very easy when one feels like I am alone to desire to not be alone. And one of the ways to do that is through sexual activity. Be mindful of that. If that's the way that your stress is showing up, pay attention to it. You not utilizing your social support and not utilizing your resources. That's a behavioral response to the stress. So I'll mention again later also, but to put it in here, things like telemedicine. Most doctors, medical providers, most mental health providers have switched to telehealth now, where they can navigate this with you through the medium of Zoom or whatever resource they're using. So pay attention to using your resources when you feel like you're shutting down and what does it matter anyway, and I can't get through anyway. You have to know that that's a behavioral response, just being overwhelmed. I need to file for unemployment. The call is taking 100 years. Get on the line for 100 years, because not doing it is the behavioral response to this isn't going to matter and I feel helpless and hopeless. Existential, that's that spiritual piece that I talked about. So two terms that I want to make sure we understand as we're navigating through this part of it. So existential angst, which is deemed normal when you think about the existential framework. Existential angst is quite normal, and it's the byproduct of acknowledging the futility of existence while still seeking to forge meaning in our daily lives. So basically it's saying at some point we know I don't have control over that, And yet I keep trying to have control over it. And so existential angst is that place of that comes out of the clash between those two things. In the mental arena, we call it cognitive dissonance, where things don't make sense. I am doing this webinar at the same time. Life out there is not even normal. Why am I doing this webinar again? Why am I getting up and getting dressed every day? Does anybody understand what's really going on? So existential angst is that feeling of so what that can come if we don't manage that angst well. We land in despair, and despair basically says it's hopeless. So it couples with hopelessness to say it's futile. Why should I do it anyway? And the existential crisis. So you have existential angst, and existential crisis is when your worldview, that's the thing that gives your life meaning and structure. When that is completely shattered, you have an existential crisis. That's the collapse of the belief in purpose and meaning in life. And when you no longer believe in your purpose, when you no longer have meaning for life, you've got utter hopelessness. So when you've got despair or helplessness and you combine that with hopelessness, then you're at the place of it doesn't even matter anymore. And that can be something that we're experiencing as we go through our world kind of falling apart and waking up and realizing I don't have power and control over anything that's going on out there. So what's the use? So if you're experiencing any of those things, then those are the symptoms. So you've got the stuff coming in, the news coming in, the unemployment coming in, the struggles with the family coming in, and it lands in you and on you physically, emotionally, behaviorally, existentially, and it shows up in any of those pockets that I'm talking about. So I want you to think about as we kind of lay those as the groundwork. Now we spend the next few minutes and figure out, so what are we going to do with that? How are we going to navigate through this? And I'm looking at your chats, guys. You are so awesome. I'm looking at you encouraging each other through that, everything we're talking about, just supporting each other, realizing that there's this thing called universality that says that as unique as I am, I'm really not that different than at least one other person in the world. And it's so cool when you're able to connect with each other on this platform. Thank you all for sharing on that level. Let's take a look at the next piece of what we're going to do now that we understand what the factors are coming in and how they show up in us. So what do we want to do? Let's go to the next slide and talk about some of the interventions. Remember, as we go through these, absolutely not exhaustive. We are going to go over these in more detail over the next couple of weeks. So this is kind of overview-ish. If you never come on to any of the next ones, this will give you something to work from, and the rest of us will drill down more deeply. So here's the next question. Please throw in your answers to this. Some of you have already been putting it in there. How have you been coping with COVID-19 pandemic related stress? We all have ways that we've coped in with other things already. Now think about in relation to this specific topic, how have you been coping? And be honest, what are your adaptive strategies and what are your maladaptive strategies? Now, this gets to a place of you can't tell me what's adaptive and what's not. Well, I want you to think from the framework of this, adaptive strategies being those things which at the end of this time period, you will be able to say, whew, it was good that I did that. Maladaptive will be those that at the end of this, you're going to say, oh, so 40 pounds can be gained in 3 weeks. I want you to be thinking about those things, adaptive and maladaptive. Netflix, yeah, been quite helpful if your internet can work. Exercising, good stuff. Drinking more, is that maladaptive or adaptive? I wonder what category you're putting it in there. I want to hear which category you're putting it in. Music and praying, cooking. Did someone say cooking till 3? For me, I think that's maladaptive. Well, you know, I baked about 6 dozen cookies the other day. Ask me how many are left. Taking walks around the house, really important. getting up and about. I saw the word worrying popped in there, so I want you to pull that out. We're going to work on that. Meditative breathing, beautiful. One of the weeks when we talk about those strategies, we're actually going to do some of that online. We're going to learn how to do meditative breathing, relaxation techniques. We're going to do some of that together. So thank you. Someone said, my faith in God. And that is so powerful, from the existential all the way out. And it covers every single arena. Music and enjoying nature. I've got plants growing in my backyard, so that's pretty cool. Time with family. You know, I said to someone recently, depending on how we use this, the one thing that we will have gained from this time is time. So being able to make good use of it is absolutely important. Maladaptive, I just missed, someone said something really cute, I won't repeat it. Yoga, taking time with God, praying, playing basketball with my son, games with friends on Zoom, so many things. I want to, between Tuesday and today, I want to take some of these. I'm going to try and put a list together and send it out so that if you haven't been able to figure out what to do or how to do it, self-forgiving. Yes, I love that one. Spending more time with God, stress reliever activities. Did someone say playing with duct tape? I hope you're not using the duct tape on the folks in the house that are, that's not an expression of your hostility. All right, so keep throwing those in there, guys. We're going to talk a little bit more about how we apply some of these things. So let's take a look at the next slide. You guys are cute. Thank you. So when we think about how we're going to combat pandemic-related stress, I found this graphic, and to me it just resonated, and I could have done a lot more official looking stuff, but this just really felt good, and it covered most of what I think we need to be thinking about and paying attention to. Making store runs for the elderly. Yes, you're going to see where some of what you just threw in there is they're going to fall into these categories that I want us paying attention to. So this graphic starts off with this statement: things I can control when the world feels scary. Bless the mess. And I think that that is so incredibly important. That is the serenity prayer that someone just put up. What are the things I can control? And what are the things that I cannot? Do I have the courage to address those things that I can and leave the rest alone? Reading my Bible, someone said. Following the existential framework, lowering expectations, yes. Following the existential framework, we consider that when we're in a crisis, an existential crisis, remember that's where the worldview just kind of collapses. What is purpose? What is meaning? We come back to a place of understanding, therefore, givens, death, meaning, isolation, and freedom, to understand where our inability is to change any of those givens and to what capacity. And once we start to understand what we can control and what we cannot, then we start discovering intrinsic sources of motivation and meaning. And because intrinsic means inside myself, I can't control out there. I can only control what's inside me and what's going on. So the first thing that, the biggest thing that has to be done really in combating pandemic-related stress is to accept the current state of affairs. Things are as they are, and we cannot change that in this moment. We cannot change all the lives that have been lost, and we cannot control that. So we have to accept, here's where we are right now. Now, what are we going to do about what we can do? So let's take a look at the next couple things. And the first thing someone just said, get off the idiot tube, someone called it. Those weren't my words, that was somebody else's words. How much media intake? So I can control how much media I intake. Keep in mind, it is important to stay informed, really informed with accurate information, because if we're watching too much, if we're ingesting too much information and we're not fact checking and the sources are not legitimate, then you're going to get a lot of misinformation mixed in with really important information. So we have to consider quality of what you're taking in as well as quantity of what you're taking in. Identify your source, your trusted, reliable source, balance your media outlets, pay attention to what we call peer-reviewed sources. So the CDC, the World Health Organization, and not blogs that people just write their opinions. What I'm presenting to you now, and some of these are my opinions that are filtering through some facts. So that's why there are references listed there that you go back and look at the numbers and make sure. And keep in mind that even with those sources, the information is coming in so quickly that the numbers the CDC has today might not match up with the numbers the World Health Organization has. Those numbers are not going to match up each time. So don't allow yourself to be so frustrated that nobody knows what's going on, because remember, nobody knows what's going on at some level. So pay attention to that. Give yourself a break. Pay attention even on your social media. If you have folks who like to update you on every single number every hour, tell them to stop. Tell them to stop. Someone said on Tuesday, if you are in a group chat and somebody sends out information, don't answer it, everybody. Stop replying all. Just like side message that one person who sent the message so that you're not getting 20 other pings on your phone as everybody sends back with a thumbs up. All right, so pay attention to your media intake. That's also not just the news media related to COVID-19, but all kinds of media. So some of us are into TV and are Netflixing. Pay attention to what you're watching. Like the zombie apocalypse series might not be the time to watch that now. So look for stuff that's just maybe light and fun. I love to read, so I'll read a very heavy book, but then I always kind of go back and read a Dr. Seuss or a kid's book, just something light, kind of cleansing the palate. So if you're watching news, give yourself a time limit, watch with a certain amount of it, and then step away from it for the day, or at least until the evening. There used to be a time in history where there was only one news hour, and now we seem to have 24 hours. So be mindful of that. The second thing is to consider how you're responding to others' fears. You can control that. You can't control others' fears, but you can control how you respond to it. So one of the things is to consider that, again, nobody has ever been through this before. So expecting others to be okay just because you're okay is unjust. And expecting everybody to be in a frenzy just because you're in a frenzy is unjust. So we need to have compassion and understanding. We need to know that this is someone else's experience as well as it's your own, and we're all doing this together in real time. So you kind of know your people, and you know the folks who are going to overwhelm you with their anxiety. And so you can give permission to say, I have 10 minutes for this person and no more than that, because after that, I'm beyond threshold and I need to be able to pull back. And you also know those people who can handle when you pour out and who cannot. So pay attention to how you're responding, particularly for families with children at home. Keep in mind that this is new for them. It's past spring break. That week home when that was all fun that they get every year, it's past that. Now they're going to be bored and they might be frustrated and they don't want to homeschool and they're hungry every 10 minutes. So how they're responding to this is going to be something that you'll have to navigate, how you're responding to them, even as they're responding. Take time for a break, reassuring your kids of what's going on so they understand it, limiting your family's exposure as a collective and paying attention to how they're hearing information, and keep up with regular routines. Like if you get up in the morning, you get up and you have your breakfast and you start your work and you set them up and you set you up. So it's going to be really important to pay attention to those around you. The third one, big deal, so easy. You can control how much you wash your hands. Like I've heard people just say over and over and over and over again, what, people didn't know how to wash their hands before? And truly, no. Like life gets really easy and we fall out of good habits. And it's very easy to look at somebody else and say, I can't believe he or she did that, when in fact we do a lot of things. If you pay attention to how many times you touch a knob or touch your face, like you started, this was saying, this is passed through the nasal and the mouth orifices. And when you think about how many times you touch your face in a day, unless that has always been your big thing, you don't realize that you've done it. I've got dogs. I've got 2 6-year-olds here that play with the dogs and then come back for a snack. And every time I say, go wash your hands, they're like, oh my God, because we don't realize how many things we need to do over and over and over again. But beyond this, this particular one is more than just washing your hands from the physical. This really pays attention to how much do you take care of yourself, and how much stress is coming in because you're not washing off the things that are coming in. So this connects to your entire lifestyle now, and you may have to adjust your lifestyle. Somebody said earlier, lower your expectations. It might be time to go back to basics. Do I need all that I say I need? Do I have to do all that I say that I have to do? So this connects also for, oh, I saw somebody that comment. I want to come back. Can I feel guilty for not having stress or worry? Ooh, hold on to that. We're going to come back to that. When you consider, if you're working at home, limiting your work hours. I'm a night person, so I could dawdle all day and be up till 2 in the morning doing my best work. But when this is over and I have to get back to work and my 6 a.m. work thingy starts, I'm tired again. I have to be mindful of that. So pay attention to how many hours you're doing your work, how many hours you're actually on, and focus and keep to your schedule as much as possible. Healthy diet, limiting caffeine, limiting alcohol use, limiting cigarette smoking, staying inside. Like that's just a big thing now. I know that we're under the stay-at-home order and a lot of people are still bucking that. We know that means we can still go out for essentials. But I want you to really consider what's really essential. Some of us are making grocery runs just because we're bored with being at home. And you have to consider, is this really that important? Can I make that recipe with something else? You know those cans that you have in your cabinet at the back, way in the back, reach way in the back of your cabinet, those cans that you plan to donate Thanksgiving, you don't even plan to do it, but you're going to do it. Those are the cans that are going in the box for the Thanksgiving food drive, because those are the cans that you haven't touched all year. Well, now's the time to use them. Maybe I don't need to go to the store for one more thing. I can use that can of green beans that I really didn't plan to use. So start paying attention to that. And then fourthly, think about how much you're thinking of yourself versus everyone else. Everyone needs soap and toilet paper. So stop fighting in them over the store, and take care of yourself. So someone said in one of your comments earlier that they're taking this time to really take care of the elderly, to take care of people who can't get out. Maybe when you do go to that store, if they still have buy one, get one, maybe the get one isn't for you. Maybe the get one is for your neighbor next door or down the block. And you don't have to know if they need it or don't need it, but maybe now is the time to share what you have, not to hoard it. And we tend to see that after hurricane time, when the fences are all blown down and you realize that you had a neighbor next door that you'd never seen, but I have charcoal and you have meat, so now let's cook and have a barbecue. Now might be the time to figure out how to do that with social distancing still. There was a lady, and I still forget her name, I forgot to look it up, who did an interview a few years back, who had lived through the 1918 pandemic, the flu epidemic. And she was 10 years old at the time. And she tells the story about how she and her brother and mother and father were the only family in her neighborhood who did not contract the flu. So they took on the responsibility of making soup and cooking the food, and taking that out. Her job, mom would cook, dad would check on people's homes. They had a little potato patch in the backyard. And at 10 years old, her responsibility was to take the bowls of soup and go and put it on the neighbor's front porch. She wasn't being exposed. She wasn't going in and taking care of them. I think mom, she said, would do that. But even at 10, what she was learning is that in these kinds of situations, if she spends more time thinking of others, it takes time off of thinking of ourselves. So if we can take some of the time off of self and actually start thinking about what somebody else might need, you can still provide for others, meet the needs of others, care for others. And this comes back to that whole existential crisis, resolving that. What am I really here for anyway? So if I'm here for more than my own care and just me, and I can find what somebody else needs, maybe then I feel less existential angst. So when you consider those things, it's also then important, the last point there, to remember to breathe, to make the most informed decision I can for me and my family. So again, notice I said with that young lady when she was 10, she wasn't being asked to go into the line of fire or to face the danger, but she was asked to give beyond herself to care for others. And then you also have to take care of yourself in that. For many who are working from home, you have to, someone just said you can't live if you don't breathe. So let's do this just for the fun of it, because someone just said that. Let's take a minute. I want you to take a good deep breath all the way in and hold it and hold it and exhale. And as long as you have the ability to do that, you're ahead of the game. So remember to breathe. Remember to take time to take care of yourself. Connect with others as much as you can. We have screen time, we have phone time, but you also need time to be alone. One of the reasons why this particular disease is so devastating is because of the alone that's required. And most of us don't do well alone. So this is a good time to pull out a journal, start getting to know yourselves. And if you do choose to do that, go online and maybe find a children's journal that starts to help you explore you beyond what everybody thinks of you, you without the hats, you without all of the responsibility, and just reconnect to you and what you believe and what you know and where your faith is and where your identity is, because that is what's going to allow you to continue to press forward. We're heading for some really hard times, and we have to have a sense of knowing this is what I'm here for, this is what I'm about, and we get to live outward from that. So please seek help when you need it. Again, remember I talked about the online resources, most medical providers, your mental health providers, your pastors and friends. Connect with people. Do not be afraid to say, I am afraid. I had a friend recently who had a family member who had potentially been exposed, and she was experiencing some anxiety about it. And our response was, you have permission to feel that. That's your sister. And we will have faith for you while you have fear for her. So this is a good time to carry each other through this experience. So keep those in mind. Remember to breathe, write in a journal, access your health providers, take care of your body, think about self-care activities, wash your hands, and stay inside. And we are going to continue this conversation. We're going to take each one of these. We talked about the different domains and each of these topics, and we're going to drill down a little more deeply. We will be doing one specifically on coping with grief and death and dying, because that is all around us right now. And we have to have a real good conversation about that so we're not overwhelmed by it. So we have just a couple minutes left to decide. There were so many comments that I don't know we'll have many questions, but I thank you all for putting your comments in there, being very open and participating in this, and we'll get you the information. So we have a couple minutes. Any questions, Tivasai?
Yes, we actually had one question. Can you address how to help the older population that has been isolated from their peers and the community?
That is a really good question. I had someone just yesterday who said that they have on their, this is part of a church community where their deacons would mask up and strap up. So if it's somebody who they could get access to, that they would put on their masks and be able to go in and spend time with those people who were isolated, just in some ways being able to help them set up. These were elderly people who wanted to be able to go to their church services and couldn't. And, you know, everybody's going to online, but they didn't know how to navigate that. So you had people who were willing to go in and help those elderly people go in and get their resources so that they could connect face to face to teach them how to navigate their online resources. One idea is to, for those who are older and maybe don't have smartphones, it might be to be able to get them a smartphone and be willing to pay that and show them how to be able to talk with their friends and families that are distance. And I'll throw this on that. This is to keep in mind. We're responding to this now, but I tell you, the elderly, this population is a group that have been neglected for a long, long time. So whatever we figure out to do now better be something that we're willing to continue when this pandemic has passed. The elderly, like my 6-year-old said that they wanted to write some letters. So it might be writing letters, writing cards and mailing to them. They can still get their mail. And if they're, depending on the age group, they're used to getting mails. They're used to conversations, not this electronic checking in. So this might be the time to stop texting them and give them a call and be willing to sit on the phone and listen to them talk for a long time about stuff that aren't really exciting to you. Any other questions?
We have 3 participants with their hands raised. So I'm gonna unmute Susie Batista.
Hi, Susie.
Susie, your mic has been unmuted. Can you hear us?
You might have to unmute your mic on your end, Susie, if you have it muted. Someone said we might save the USPS. Yes, go buy some stamps, make that an essential purchase, and go start writing to people again. Oh, Susie, you want to try another one to the side?
Yes, there's someone with the screen name AE95. I've unmuted your mic.
Hi, AE. Last name 95.
Okay.
All right, if your hand is up and she unmutes her end, make sure you unmute on your end. Anyone else?
We have Pat and TCL.
Anybody else with a hand raised?
Yeah, those 2 other participants, your mic has also been unmuted. Okay.
Is there a call? Yeah, I don't know. Is there a call-in number to the side? Or you just unmute on their end, right?
Yeah, I allow them to speak and I unmute, but I don't see that.
No, somebody just put in the chat if there's a call-in. I don't have a call-in.
Can you hear me?
Yes, we
Oh,
can.
I can hear you.
Yeah, I just wanted to tell everybody that this whole experience, I'm 70 years old and living completely alone. And I just want to tell you that
I can barely hear to the side. Can you hear?
yeah, no, I want to tell you that that this whole experience.
No, we can't hear her.
This whole experience has made me grateful for the life that I have had up to now. I'm prepared that maybe I'll be killed by corona, maybe not. But I'm grateful for my parents, my travel experience, my profession, and everything I have had up to now. This experience has made me grateful.
Thank you. I think if we could put a cherry on top of a very difficult time it. You just did it. And if we land anywhere, darlings, it is to be at a place of being grateful. If you can breathe, then you've got time. And if we've got time, we've got purpose. So make good use of your time. And I hope you log on as we go over this the next couple of weeks. We'll keep connecting. Have a wonderful weekend. Play safe. Wash your hands.
I love you all.
Thank you, darling.
Sonia, thank you so much for today's presentation, and a huge thank you to all of our participants for joining us and for the incredible amount of feedback. You will receive an email with the slides and an evaluation link. Please look out for that email. Also, a brief note, today's webcast was not submitted in time to obtain educational credits, but I am working on getting the credits for the future webinars, so please join us next week, Tuesday. Thank you, everyone. Enjoy your weekend.